Hi everyone. Today in this video we are going to discuss about S-Zopiclone. What is this drug S-Zopiclone? This is one of the non-benzodiazepine hypnotic agent, and here the prefix ES indicates this drug is an S-isomer of Zopiclone. Zopiclone is a non-benzodiazepine, and within this category we have few of the other drugs like zolpidem, zaleplon. All these drugs are starting with the letter Z, so these drugs are collectively called as z-hypnotics. And these are chemically not related to benzodiazepines, but still they act like benzodiazepines. That's why they are called as non-benzodiazepine hypnotic agents. And among these drugs, Zopiclone is one of the drugs which is available as stereoactive compound. And the S-isomer of this Zopiclone is called S-Zopiclone. So today in this video we are going to discuss about this S-Zopiclone. How this drug acts, what are the important precautions, contraindications, drug interactions, side effects, and clinical use of this drug we will discuss in this video. This drug S-Zopiclone is particularly used to control the insomnia. It is used as hypnotic and it can reduce the insomnia in the patients. So in the patient suffering with lack of sleep, S-Zopiclone can be given, and this drug acts just like the benzodiazepines and it reduces the time for sleep induction. At the same time, it increases the total sleeping time and duration in the patient suffering with insomnia. So this drug can be given at bedtime in order to increase the sleep maintenance, and this drug can be used up to 6 months in order to treat insomnia. Now let us see the chemical nature of this drug. So this is the structure of S-Zopiclone, and here we can clearly observe that it is not having the benzodiazepine ring system, but it is having one of the large moiety here. This is nothing but cyclopyrrolone ring system. That's why S-Zopiclone is considered as cyclopyrrolone derivative. Within this structure we can also observe a fused heterocyclic ring system. So this is the ring, and here pyrazole ring is fused with the pyrazine. So this is nothing but pyrrolopiperazine ring system. In this way, Zopiclone is a pyrrolopiperazine derivative. Now let us see how this drug acts. So within the CNS, GABA A receptors are present, which are inotropic receptors, and they are pentameric in nature. They are made up of 5 subunits. On these GABA A receptors, GABA can bind and it can produce CNS inhibition. We know that GABA is a inhibitory neurotransmitter within the CNS. But in order to facilitate the action of GABA, GABA A receptor is equipped with so many sites where many of the drugs can act, and they can modulate the activity of GABA-gated chloride channels. So here S-Zopiclone is one of the non-benzodiazepine, but it just acts like the benzodiazepines. It can bind to the site nearer to the benzodiazepines, thereby it can facilitate the action of GABA on the GABA A receptors. Once this drug binds to GABA A receptors, it facilitates binding of GABA to GABA A receptors. And when the GABA binds to GABA A receptors, it opens the chloride channels. So chloride ions can enter into the cell, resulting in hyperpolarization. Because chloride ions are in negative charge, they produce hyperpolarization. This hyperpolarization reduces the excitation of the cell membrane, and it increases the hypnosis and increases the sedation in the patients. In this way, S-Zopiclone is mainly used as hypnotic drug, and it can induce the sleep in the patients. What are the precautions? One of the important precautions of S-Zopiclone is that this drug can produce some strange behavior, some abnormal thinking, and within the patients we can observe few of the symptoms such as aggressiveness, agitation, some hallucinations, depersonalization. The patient may feel some unreality. All this can be observed with this drug, and particularly these effects are mainly observed because of reduced inhibitory response within the CNS. So when the inhibition is reduced, it may lead to few of the psychotic symptoms, resulting in aggressiveness, agitation, hallucinations, and some abnormal behavior. And this drug can also produce another abnormal activity in the patients. It can produce some sleep driving. In this condition, the patient loses awareness, and during the sleep, they can follow few of the activities. For instance, a walk during the sleep or eating the food during the sleep. Such type of abnormal behavior may be observed in the patients who are treated with this drug. So precaution should be taken to control these effects within the patients. Second important precaution is that use of this drug in patients with depression. When this drug is given to the depressed patients, it can increase the depressive symptoms and it can increase the suicidal initiation. Even it may increase the suicidal attacks in the patients, resulting in the increased intentional overdosing of the drug, which may further increase the suicidal attacks. So this drug should be carefully given in the depressive patients, which may increase the risk of suicidal attacks. Third important precaution of this drug is that this drug can produce severe anaphylactic reactions. These are the hypersensitive reactions produced by release of IgE antibodies. These IgE antibodies can act on the basophils as well as mast cells, which are equipped with IgE receptors. Now, when this IgE binds to these IgE receptors, it can produce degranulation and release of mediators such as histamine and other inflammatory mediators, which produce inflammatory reactions like angioedema. This angioedema results in the swelling of tongue, glottis as well as larynx, and nausea and vomiting, dyspnea, difficulty in breathing, as well as throat closing, the closing of throat pipe. All these results in the obstruction of air pathway, which is fatal in the patients. So this drug should be carefully given in the patients, and whenever they are developing any anaphylactic reactions, the drug should be replaced with alternative agents. Similarly, this drug can also produce anaphylactoid reactions. These are just similar to the anaphylactic reactions, but they are not mediated through the IgE antibodies. So hypersensitivity is one of the important precautions that should be taken when this drug is going to be given to the patients. Similarly, S-Zopiclone is mainly used to decrease the insomnia and it increases the sleep. But sometimes when this drug is going to be prescribed, even after 10 days of the treatment, the insomnia is not controlled and there is no significant improvement in the insomnia. In such conditions, the treatment should be evaluated, and the insomnia in the patient may be related to any mental illness or any psychotic disorders within the patients. So in the patients who are having mental illness or psychotic disorders, they may have insomnia, which should not be treated with S-Zopiclone, because this drug further increases the psychotic symptoms without any improvement in the insomnia. So this drug should be used in the patients who are only suffering with insomnia without any underlying psychotic disorders. Similarly, another important precaution is that this drug can produce some psychomotor impairment. This type of side effect is also observed with benzodiazepines, and here S-Zopiclone can also produce some psychomotor impairment, and particularly these effects can be observed from the next day of the treatment, so they are called as next day effects. This mainly involves the decreased awareness in the patients, decreased alertness and dizziness in the patients, impaired muscle coordination, lightheadedness, and some memory impairment. All these result in the decreased motor performance in the patients. So patients who are having the activities like driving or working with machinery, they may have some impairment in their skills because of this S-Zopiclone, which can be observed from the next day of use of this drug. So care should be taken in the patients who are working with machinery. And particularly these effects are related to CNS depressant activity of this drug, and they are also related with the dose. The psychomotor impairment is observed at a dose of 2 to 3 mg. Not only with the dose, this impairment is also associated with timing of the drug. This drug should be given at the bedtime, but when it is given at the midnight, it can produce some psychomotor impairment. That's why this drug should be given in the patients who are having a sleep cycle of 7 to 8 hours, such that this drug cannot produce any next day effects. Similarly, other CNS depressants like alcohol, opioids, TCAs, tricyclic antidepressants, and even other benzodiazepines, all these drugs can produce CNS depression. So when they are given with S-Zopiclone, This drug can also produce severe CNS depression, resulting in psychomotor impairment. So these drugs should be carefully combined with S-Zopiclone. What are the drug interactions? This drug S-Zopiclone is going to be metabolized by cytochrome P450 system, and among them one of the major metabolic enzyme is CYP3A4. So we have so many types of drugs which are going to either enhance or inhibit the activity of this CYP3A4 enzyme. For instance, we have the drugs like azole antifungals such as ketoconazole, itraconazole. These two drugs are the strong inhibitors of CYP3A4 enzyme. Similarly, if you have the other drugs like ritonavir, which is an antiviral agent, clarithromycin, macrolide antibiotic, nefajadone, which is an antidepressant, all these drugs are going to inhibit the CYP3A4 enzyme. Thereby, they can increase the levels of S-Zopiclone, resulting in increased adverse effects. So, when these drugs are combined with S-Zopiclone, the CNS depressant activities are further increased, resulting in severe hallucination, motor impairment, and other psychotic symptoms. Similarly, if you have the drugs like rifampicin, carbamazepine, these drugs can induce the CYP3A4 enzyme activity. Thereby, they can increase the metabolism of S-Zopiclone, resulting in the decreased activity of this drug. So, care should be taken when these drugs are combined in order to minimize the drug interaction. What are the contraindications? We have seen that this drug can produce hypersensitivity reactions, particularly it can produce angioedema, which may result in the swelling of the tongue, glottis and larynx. Finally, it may lead to obstruction of air pathway, which is fatal to the patients. So, if any hypersensitivity is going to be developed in the patient, then this drug should be contraindicated. What are the side effects? The important side effects of S-Zopiclone mainly include headache, dry mouth, somnolence, sleepiness, dizziness, rash, and unpleasant taste in the patients. It can also produce some anxiety, which may be due to any rebound effect, and hallucinations, muscle incoordination, chest pain. Some viral infections as well as respiratory tract infections can be observed with this S-Zopiclone. How it is given? This drug is available as a tablet form and it is available at 3 strengths, 1 mg, 2 mg as well as 3 mg. The initial dose of the drug should be very low in order to minimize hypersensitivity as well as next day effects. That's why the recommended initial dose is 1 mg immediately before the bedtime. This is again important because this drug should be given just before the bedtime, and if it is taken during the midnight, it may produce psychomotor impairment. That's why this drug should be given whenever the sleeping time available is 7 to 8 hours. So when this drug is taken at the bedtime, during these 7 to 8 hours, this drug can improve the insomnia and increase the sleep maintenance, and it may not produce any severe next day side effects. The dose can be increased based on the effectiveness of this drug, but the maximum dose is 3 mg before the bedtime. Since this drug produces some memory impairment as well as motor impairment, the dose should be somewhat less in the geriatric patients, and the maximum dose in the geriatric patients with age greater than 65 years is 2 mg only. So above 2 mg, it should not be prescribed to the geriatrics in order to avoid unwanted motor as well as memory impairment. So that's about this S-Zopiclone. This drug is an S-isomer of Zopiclone, which is a z-hypnotic, and chemically it is not related to the benzodiazepines, but pharmacologically it acts like benzodiazepines. That's why it is categorized as non-benzodiazepine hypnotic agent. Chemically, this drug belongs to cyclopyrrolone ring system and is also having pyrrolopiperazine ring system. This drug is going to increase the action of GABA on the GABA A receptors, thereby it opens the chloride channels resulting in hyperpolarization and reduced excitation resulting in increased hypnotic as well as sedative activity. This drug may produce hypersensitive reactions like angioedema, which should be carefully monitored in the patients, and in case of angioedema, this drug is contraindicated. Just like the benzodiazepines, this drug can also produce some psychomotor impairment, and it can produce some next day effects like daytime anxiety, dizziness, lightheadedness, hallucinations, decreased awareness, alertness, and impairment of memory. Similarly, this drug can also produce some strange behavior as well as abnormal thinking within the patients within first week of treatment, and it can also produce some sleepwalking, which should be closely monitored. This drug is available at different strengths like 1 mg, 2 mg, 3 mg. Normally it is initiated at a low dose of 1 mg just before the bedtime, and at least 7 to 8 hours of sleep time should be available in order to eliminate next day effects of this drug. The maximum dose is 3 mg, but in the geriatric the maximum dose is only 2 mg in order to prevent psychomotor impairment. So that's about this z-hypnotic drug S-Zopiclone. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.